Hi, welcome to Wessex Rehab. My name's Fiona and I'm going to guide you through the health and safety briefing on the climbing wall. Before you decide if you're happy to come and climb with us, there are a few things that we need to draw your attention to, tell you what you need to do and what we do to reduce the risks of climbing and make this a safe activity for you. To keep our climbing wall nice and clean, we'll ask every participant to use liquid hand chalk. It acts an awful lot like hand sanitizer. It does contain alcohol, but it will also improve your grip on the handholds and it just makes you look really cool. The first major risk that we need to make you aware of with the climbing wall is that it does have a texture to it. So what that means when you're climbing along, if you were to scrape up against it, it could leave a graze or a minor abrasion on your skin or on your nails. The most commonly affected area are your knees and your elbows, so we'll ask all participants to wear trousers and we recommend long sleeves.
It will also be a requirement to remove all jewellery, including any loose pieces of jewellery you may have. You can tuck those in or just remove them. Also, if you have long hair, we'll request that you tie that back so it is off your face and away from the wall.
The second thing to make you aware of is that if you were to step off the wall and land awkwardly, you could sustain a foot or an ankle injury. To prevent this, we ask everybody to wear tight shoes, ideally lace-up shoes, and we'll be keeping the matted area completely clear of obstructions. So if you do come off the wall, you can be sure you're going to be landing on a stable surface. Like any strenuous exercise, before you take part, it's really important to warm up with some appropriate movements and some stretches. Here are the Wessex Rehab team giving you an example of things you might be able to try. The third thing to draw your attention to is the proximity of the rear wall. So when you're climbing along, if you were to come off the wall in a very uncontrolled fashion, there's a small chance that you'd hit your head on the wall or the radiator behind you. Because we don't want that to happen, we're going to provide you with a spotter, and a spotter is a member of Wessex Rehab staff who's been trained to keep you safe. They'll be walking along behind you and they may secure you to the wall just by pushing gently on your back if you look like you're becoming unstable. So please do bear in mind that our spotters are potentially going to touch you as you move along. They'll also offer encouragement and instruction if you need it. And if you look like you're finding it very easy, you can expect a bit of friendly banter and perhaps some chit chat to put you off. So if that hasn't put anybody off the climbing activity, come on down and have a go.